Every second that a stroke goes untreated, your brain is dying. When a major artery gets blocked, you lose about 1.9 million brain cells every single minute. That's nearly 32,000 cells a second. The damage adds up with terrifying speed, threatening the very things that make you, you. The clock is ticking, and for a long time the options were grim. But what if you could go inside the most complex organ in the body, snake through its delicate pathways without ever opening the skull, and literally pull the plug on a stroke? In this video, we're taking you inside the incredible procedure where doctors race against time to snatch a deadly clot from the brain and restore life in minutes. To understand the cure, you have to understand the crisis. Your brain, while only about 2% of your body weight, is incredibly greedy. It hogs a massive 20% of your body's oxygen and blood. It's a bustling city, powered by a dense network of blood vessels that act like highways, delivering vital supplies. An ischemic stroke is what happens when one of those critical highways gets shut down by a traffic jam, a blood clot. Let's meet Sarah, a teacher in her classroom. 1 minute she's explaining a lesson, and the next, a strange feeling washes over her. Her words start to slur. The pen in her hand feels like a foreign object, refusing to move. Deep inside her brain, unseen, a blood clot has wedged itself into a major artery, the middle cerebral artery, one of the most common places for a severe stroke. This clot might have formed right there, but more often it's a traveller, an embolus that started somewhere else, maybe the heart, and journeyed until it got stuck. Instantly, the part of the brain fed by that artery is plunged into darkness. Brain cells, starved of oxygen, start to panic. Right at the blockage is the infarct core, an area where cells begin to die within minutes. It's ground zero. But surrounding this dead zone is a larger, salvageable area called the ischemic penumbra. This region is hurt, but it's not gone yet. It's a battleground, a territory of brain tissue desperately waiting for rescue. The fate of this penumbra and Sarah's ability to speak, move, and think again hinges entirely on one thing: how fast blood flow can be restored. A student in Sarah's class sees her face droop on one side. Her words are garbled. He's seen a health campaign and remembers a simple acronym: FAST. Face drooping, arm weakness, speech difficulty, time to call for help. That one act of recognition is the first and maybe the most crucial step in saving her life. The second that 911 call is made, an invisible timer starts. Paramedics are there in minutes, trained to spot a stroke. Their job isn't just to drive, it's to get the patient to a specialized stroke center as fast as humanly possible, because every minute wasted means more brain is lost forever. For decades, the go-to treatment was a powerful clot-busting drug called TPA. But for massive clots in major arteries, TPA often just wasn't enough. The clot was too big, too stubborn. This is where the game has completely changed. For patients like Sarah with a major blockage, there's a new procedure that offers an incredible window of hope: a mechanical thrombectomy. And while sooner is always better, this procedure can sometimes be performed up to 24 hours after symptoms begin, which has totally revolutionized stroke care. Sarah is rushed to a comprehensive stroke center where a specialized team is ready to go around the clock. The race is on. When Sarah hits the emergency room, she's met by the stroke team. There's no time for paperwork. She's whisked away for an immediate brain scan, usually a CT and a CT angiogram. This isn't just to see the damage, it's to create a battle map. The scans tell the doctors 3 critical things. First, they confirm it's a stroke from a clot, not a bleed. Second, they pinpoint the exact location of the enemy clot. And third, most importantly, advanced imaging shows them the penumbra, the amount of brain tissue that's still salvageable. This is the deciding moment. If the scans show too much dead tissue, the risks of the procedure might be too high. But in Sarah's case, there's a large area of brain just waiting to be saved. The green light is given. A neurointerventionalist, a highly specialized doctor, is called in. They've seen the map, they know the target, and they have the tools to get there. The mission is a go: mechanical thrombectomy. They're about to travel through the body's own highways, all the way to the brain, to physically pull out the clot. This isn't open brain surgery. Sarah's skull won't be opened. She might even be awake or lightly sedated for the whole thing, which lets the team monitor her brain function in real time. The procedure starts somewhere you'd never expect: the groin or the wrist. A tiny puncture is made in an artery there, and a thin tube called a catheter is slipped inside. This is the on-ramp for an incredible journey. Using a live X-ray called fluoroscopy as a map, the neurointerventionalist skillfully pilots this catheter through the body's largest artery, the aorta. They guide it up past the heart, through the neck, and into the complex, branching vessels of the brain. It's like flying a microscopic ship through winding rivers to a precise, hidden location. Once the main catheter is in place, the real work begins. The doctor now has to deploy their specialized tools. Through the larger catheter, a microcatheter, about the size of a piece of spaghetti, is carefully advanced right up to the face of the clot. From here, the doctor has two main weapons. The first is a stent retriever. It's a tiny, self-expanding mesh tube. The doctor pushes the microcatheter right through the soft clot and deploys the stent retriever on the other side. It opens up like a metal cage, embedding itself into the clot and grabbing it from within. After a few minutes, the stent retriever and the clot it's captured are slowly pulled back. The second weapon is suction or aspiration. With this technique, a slightly larger catheter is brought right to the clot. A powerful suction pump is turned on, and the catheter literally vacuums the clot right out of the artery. Often, doctors use a combination of both to get the job done. The amount of skill this takes is immense. They're working in vessels just a few millimeters wide, where one wrong move could be catastrophic. This is the moment of truth. The neurointerventionalist has the clot grabbed with the stent retriever and is applying suction. They begin to slowly pull the system back. In the operating room, the entire team holds its breath, their eyes glued to the monitors. On the screen, they see the dark, lifeless area of the brain where blood flow was cut off. And then, it happens. The clot is pulled free. Instantly, blood surges back into the starved vessel. The image on the monitor, which just showed a dead end, now blossoms with a rush of blood, flowing freely into brain territory that was on the brink of death. The penumbra is being reperfused with life-giving oxygen. The city's power is back on. It's a visually stunning and deeply emotional moment. Sometimes, the effect is immediate. A patient who couldn't speak or move a limb might suddenly show improvement, right there on the table. For Sarah, this is the turning point. The villain is gone. While pulling the clot out is a huge victory, the road to recovery is just beginning. Sarah is moved to a neuro-intensive care unit for close monitoring. The first 24 hours are critical for managing her blood pressure and watching for any problems. But the results of a successful thrombectomy can be breathtaking. Studies show that for the right patients, this procedure dramatically increases their chance of living an independent life. Nearly half of the patients who get a thrombectomy have little to no disability 3 months after their stroke. Recovery takes time and hard work, with dedicated rehabilitation. But the foundation for that recovery was laid in that operating room. By restoring blood flow so quickly, the doctors saved millions of brain cells, preserving the connections needed for speech, movement, and thought. Weeks later, with the help of therapists, Sarah starts to get her life back. The slurred words become clearer sentences. The weak arm regains its strength. The procedure didn't just save her life, it saved her quality of life. The story of mechanical thrombectomy is an amazing testament to human ingenuity and medical progress. It has turned a diagnosis of severe stroke from a near certainty of disability into a race against time with real, tangible hope. But the most powerful tool in fighting a stroke isn't in a hospital. It's you. The success of this entire journey hinges on one thing: getting to the hospital fast. And that starts with recognizing the signs. Remember the acronym B FAST. B is for balance. Is the person suddenly having trouble with balance or coordination? E is for eyes. Is there a sudden change in vision, like blurriness or loss of sight in one or both eyes? F is for face. Ask the person to smile. Does one side of the face droop? A is for arms. Ask the person to raise both arms. Does one arm drift downward? S is for speech. Is their speech slurred? Are they hard to understand? T is for time. If you see any of these signs, it's time to call 911 immediately. Don't wait. Don't drive the person yourself. Call an ambulance. Paramedics can start life-saving care on the way to the right hospital. Knowing these signs, and more importantly, acting on them, can make the difference between a full recovery and a lifelong disability. Share this video. You could be the first link in a chain that saves a life.